Onto the pharma space, the Central Drug Standard Control Organization, that's the CDSCO, has formed a subcommittee to look into guidelines that govern over-the-counter drugs. Now, these are medicines that can be purchased without a doctor's prescription. Timsy is standing by with more details. What exactly is the purpose of this review and what will this subcommittee look into, Timsy?
Well, in what could be a game changer in terms of medicines and drugs available without prescriptions at retail outlets and chemists, the Central Drug Standard Control Organization has constituted a 8-member subcommittee to revisit guidelines and include relevant amendments in the provisions for drugs to be declared as over-the-counter or OTC. Sources have told CNBC-TV18 that the move comes on the back of the recommendations of the Drug Technical Advisory Board meeting, which was held earlier this year in January. So what are over-the-counter drugs? Well, OTC drugs and medicines are those which can be sold at retail outlets and chemists without any prescription from a registered medical practitioner. Sources say that this proposed subcommittee will also examine the matter with reference to various conditions based on which the status of a drug as an OTC is decided, along with coming up with a new and detailed mechanism for the drugs to be considered as OTC, including reference from international guidelines. The subcommittee has a time of 3 months to submit its report, and it will also incorporate suggestions from different panels and committees of clinicals that have been constituted by DG Health Services on the similar matter. It is also understood that there are several representations pending with the CDSC or the drug controller to include drugs under the OTC category. And once these guidelines are adopted, the process might be easier, simpler, and more up to date to assess which drugs can qualify under this category. Back to you.